Good morning and welcome to our OLSHF webinar series. I'm Doug Thompson. I'm the Executive Director of the Oregon Lion Sight and Hearing Foundation, and with me today is our Patient Services and Operations Director, Kareth Vance. Good morning, Kareth.
Good morning.
How are you today?
I'm doing pretty good. How are you?
Good, thanks. So our webinar today is so your kid needs glasses, now what? We're really excited about having Kareth share with you the different resources available for kids that need comprehensive eye exams and eyeglasses. We know that many of our attendees are school nurses, so welcome to some of our best friends in the state of Oregon, the wonderful nurses that work in schools around the state of Oregon and help us connect kids that need them to comprehensive eye exams and eyeglasses. We're going to take just a moment to kind of give you a quick overview of how, not so much how, but the impact that we have in terms of identifying kids with vision issues. Our flagship program is actually school vision screening. And we created as an organization last decade, a 2020 vision that one day all children in Oregon would have their vision screened, and those that need them would be referred for comprehensive eye exams and eyeglasses. And our next slide here will show really an illustration now. We have grown from screening 25,000 students a year to last year over 180,000 students in public schools in Oregon. The different color codes that you see there are our different staff members, but it again illustrates where we are having such an impact all around the state of Oregon, working with school nurses and schools to screen kids using that state-of-the-art technology down in the lower right-hand corner. That's the Welch Allyn Spot computerized photo vision screener, which can identify up to, I think, 11 different vision health issues and refer, again, those that need them to comprehensive eye exams. Now, I think anecdotally, we all kind of know that, if a child isn't seen as well as they should be, that they're probably not doing as well in school as they should be. The next slide here is of one of our best friends, Dr. J.P. Lowry, one of the lead pediatric optometrists at Pacific University, and he's our advisor. He helps us with the settings of our technology to make sure that we are not having false positives, and as much as possible, we're very accurate in terms of our vision screenings. And JP is doing this incredible study that is in partnership with the Salem Kaiser School District, doing an analysis of third graders that we are screening, has identified preliminarily that those that we are referring as needing comprehensive eye exams are actually scoring, on average, 10 points lower on both the English and the math standardized tests. So again, we all kind of know that, gosh, if a kid has glasses, they're probably going to do a better job of reading at grade level. Studies also show that a third grader not reading at grade level is 13 times less likely to graduate from high school. So I know I'm probably preaching to the choir here for a lot of you in terms of the importance of identifying kids that need these comprehensive eye exams. And what we're going to do here in just a moment is actually, we're going to show you a quick video of another one of our vision professional partners that helps us with a program called the KEX Kids Fund. And Kareth is going to get into details of it, but at this point, I'd like to really quickly just introduce Dr. Rainey Delplanche, who is a Beaverton optometrist, and Dr. Delplanche is going to give a little bit of an overview of the KEX Kids Fund program.
So what I've noticed over the years is a lot of kids are struggling readers and struggling with school. And a lot of these kids have similar kind of eye problems. And I always, as I explain it to parents, they're sort of the invisible eye problems. They're the kids that have maybe an imbalance of one eye a lot stronger than the other, maybe one eye significantly farsighted, some unusual astigmatism. And the kids oftentimes think they see okay, and oftentimes they will pass a traditional school screening. But when they come in here, they're not really seeing exactly right. And I can show the parents how the vision is a little bit reduced, but not terrible. But the minute you show them print up close, they really struggle. And over the years, especially working with the school district and how they've worked with the KEX Lions with the spot technology, they started referring all these kids that they could pick up with the spot test that confirm what I've been telling families for years. This uncorrected astigmatism and farsightedness is really slowing down a lot of the reading ability with these kids. And oftentimes, the parents are more resistant than the kids to wearing glasses, but when we get them glasses, there's a huge improvement with their school performance. And I've heard that from the school nurses and from teachers directly, as well as the family too. There's a huge barrier between the families and affording eye care, and there's a lot of fear in will they pay for it. And the schools, they're very well networked with the KEX Kids Fund, and they have vouchers that they offer these families. And just yesterday we had this one young lady, and she had terrible vision and never had glasses, and so we were able to use that voucher to give her some glasses. And so, I mean, just yesterday. So it doesn't happen every day, but boy, more often than not, we get families coming in and they would normally endure without lenses. And I haven't heard how well she's going to do with her glasses because she hasn't got them yet, but I have no doubt that her academics will just increase once she can see so much better. And the function of vision will improve tremendously with her reading skills. I would say the bottom line result of the KEX Kids Fund is that it is bringing into the fold of eye care hundreds of kids every year that would not receive eye care otherwise. And this allows us to see those kids and give them care. And many of them are outside of, let's say, the Medicaid program and private insurance program.
And again, Dr. DePlanch is one of dozens and dozens of providers that we work with around the state, connecting families to the vision health care that they need. I mean, again, in terms of preaching to the choir here, I do want to emphasize the fact that in Oregon, unfortunately, we are still ranked as low as like 48th in the nation in high school graduation rate. And we strongly believe that working with partners like Dr. DePlanch will help get more kids to the eye doctor, get eyeglasses on them, help them academically, and we can help Oregon, move up the ranks and graduate more kids from high school. So to talk more specifically about how we partner with folks like Dr. DePlanch and utilize other resources to help families lacking resources, again, here is Kareth Vance that's going to let us know how we can address this issue. Kareth, take it away.
Thank you, Doug. All right, so now you've got a child who needs follow-up care. Maybe you're a school nurse or their teacher has noticed something in the classroom or in their behavior at school or in interacting with them, most likely right now online through the video conferencing that you're doing with students right now for most parts of the state. Or maybe you were even one of the families who received a referral from the Oregon Blind, Sight and Hearing Foundation following a school vision screening. We are doing a few of those this year as we're able to and do those safely. But however you got that, now you've got this form and this information that your child needs an exam, that there may be something going on with their vision, they might need glasses. One of the neat things that comes out, just so you know, with the referral form from the Oregon Blind, Sight and Hearing Foundation is a list of different providers throughout the state of Oregon that you can call and get help from. And it also includes our KEX Kids providers are on that list as well. So it's a really great resource. Now for the family, you've got this list, you've got this referral, and now you want to know what to do next. Well, one of the options is if you're a family who has private insurance, maybe you have Kaiser or Blue Cross, one of these insurance plans. And so you're able to just call up a provider that's either listed for your health insurance or you're going to call around to one of these providers on the list and you're going to go sign up. You're going to get your child their exam. And then if they're needed, they'll be able to get eyeglasses through their insurance. Now, one of the things that is a challenge with private insurance that some of the families run into is there can be expensive copays involved. So it may be that you have to pay $100 out of pocket before you can actually get those glasses. There may be limited coverage. Maybe you can only get a pair of glasses every couple of years. Or your plan may say, hey, you can get an exam every year, but we're not covering glasses. So private insurance is great, but there are a few challenges out there that families may run into. The other insurance option that a lot of our families are working with is our Care Oregon or Oregon Health Plan system. So this is a great system. It covers a lot of our families are completely enrolled in their health insurance program. What you may or may not realize is that in Oregon, all children under the age of 18 are actually allowed to have coverage for exams and eyeglasses through OHP and Care Oregon. That includes documented and undocumented individuals, as long as they live under 300% of the poverty level. And generally in this particular program, it's going to be, for most of those families, it's going to be free. So it's accessible, it's affordable for the family. The challenge can be, there are some challenges involved, and I'm going to go through a few of those. So one of the biggest challenges that we find is that parents don't understand the coverage that their kids have, or may not even be aware that if their kids are covered, that it includes vision care. And a lot of times that's because for adults, a lot of the OHP programs don't cover glasses for adults, and may not even cover exams for adults. So they just automatically think, well, my kids aren't covered because I'm not covered. The other thing is that for the OHP program is it's difficult to navigate or even advocate for yourself in using these programs. A lot of the parents really struggle with figuring out, how do I apply? Where do I call if I do have this program? Where do I go? Where are my providers? They can be really overwhelmed with calling around and trying to find a provider who takes the insurance. And the other part, what we found out through our providers is that technically when you look on the website, it'll say that you can get a pair of eyeglasses and an exam for your child every year. Now, what some providers have found out is that they can get those replaced if they're lost, they're broken, there's different things that happen. But those providers advocate for the families and call and really help negotiate and say, no, you guys really should be covering this for this family. Well, the families we're generally working with, especially right now in the midst of everything going on in the world, they're overwhelmed. And so them being able to navigate and understand their plan and even advocate for themselves is really challenging. So it's great that OHP is there and Care Oregon is there, but there are some quirks with it. The other thing is, a lot of people, maybe they just moved to Oregon, so they've just signed up for school. They had their insurance in Arizona or wherever they're from, but they don't have it here in Oregon yet. And it can be a few months for parents to gather all their information, get the documents, and get going with their plan. There can be this gap. Same with the parent who maybe is transferring into an insurance plan or out of a different insurance plan. There may be a gap where they're just not covered. And as teachers and counselors know, if you have a student that has to wait for 2-3 months for their coverage to kick in for their glasses, learning goes by so fast. That's a lot of things that those kids are missing by not being able to have that. The last thing I want to mention here is fear of applying. So I mentioned that now it's a new feature of Care Oregon, so not everybody knows about it, that undocumented children can be covered. But let's just be open and be frank that a lot of undocumented families are fearful. They are afraid to even take their kids to a doctor if we give them a voucher, let alone to turn in any of their personal information and sign up for a plan. It can be a very scary thing because they don't know, based on their past experience or even their present experience, where that information is going to go. And they can't, a lot of them, what I hear from other community service groups is that the families are afraid that this information is going to cause problems for them, even being in the country and being able to have their kids in school. So they just don't want to apply. It's a very scary thing for them. So that's another option. It's got great things about it. It's also got some challenges. And then the next option is Sight for Students. So this plan, it's called Sight for Students. It's actually offered through a national company called Vision Service Plan. It's a gift certificate, and schools can actually receive them if their nurse is a part of the National Association of School Nurses. They have access to these gift certificates. The Oregon Lions Sight and Hearing Foundation also has some access to these through our Lions Club International Foundation. They work with Vision Service Plan for an adult program, and sometimes we can get these certificates for the kids. It's a great program. It covers kids that are under 19, whose families are at 200% of federal poverty or below. They can access the program once every year. The big catch for Sight for Students, and they have an adult version of the plan that's kind of the same thing, is that if the families already have any kind of private or state vision insurance, this certificate's not going to work. So say you have medical insurance that covers your exam, but not your glasses. Well, this certificate's not going to work because you do have some vision insurance, or you have vision insurance with a, say it's a $200 copay, but you still have insurance. So this plan is really meant for people that don't have it, for the kids that don't have it. So I understand some schools are very successful using these. If your school runs out or you need them, let us know, because we may be able to help get those out there to you. But just so you know, if that this is an option that's out there definitely for schools and for other organizations like Boys and Girls Clubs will use them. There's all kinds of different organizations out there that get access to these gift certificates. And so now I'm going to move on to talking about my favorite option for vision insurance, which is the KEX Kids Fund. KEX Kids Fund, the fund itself is actually a 501c3. It's a nonprofit organization that was established back in the 1980s to provide students with free comprehensive eye exams, eyeglasses, and even hearing aids. The program started with Bob Miller many years ago because at that time there was not coverage of any kind for kids, and there was a huge need out there for students to be able to get care. So he started the fund all that time ago, and the nonprofit is currently managed and administered by Vicki Lindman, whose husband is Paul Lindman, and works very strongly with her. And there's a team of us that get together and work for the fund and talk about how to grow it and things like that. And we collaborate with them and have been for over 20 years by managing the vision portion of where their funds go. So I'm going to talk now specifically about the KEX Kids Fund program that the Oregon Lions Sight and Hearing Foundation operates. And just so you all know, because I know some of the school nurses that are out there listening may know about this, and some of the other listeners, but not everybody does. There is a hearing program. So KEX Kids Fund, the nonprofit, has both a hearing and vision service. So they do offer help with hearing aids, other hearing equipment, with ear molds. There's a lot of things that they can do to help kids. That program is managed separately by Glenda Fowler. She's in the Salem area, and she's part of the Willamette ESD. And so she manages all the hearing program information, but I can get you her contact information. So at the end, you'll see my contact information. Let me know, I'll connect you with Glenda, and she'll help get your kids set up with the hearing program as well. But now for the vision program, this is operated.
Hey, Karen, we have a couple of questions that have come in. Is it okay if I have you answer them? So first question from Kelly: how can teachers, nurses, or parents who feel that they need to have their child have an exam and glasses, how can they obtain these services when schools are now going through distance learning?
That is a great question. So I'm going to talk about this a little bit more when I talk about the application process. But just so you know, yeah, basically the program has always operated by you reach out to your school, and that's how you get the certificate. What I'm understanding from the school nurses and contacts that I'm interacting with is they are still, they're interacting with their students. The teachers are feeding them a lot of information about their students that needs referrals. Families can also reach out to us directly. So I always suggest reaching out to their school first. Ask for your school nurse or your school counselor. I've noticed that a lot of the schools right now, their websites are getting really updated and really strong with who to contact at the school and how to do it. So a lot of your school contacts emails are going to be on your school, your school's websites, but you can also just reach out to me and I can help you out with that. We do have some people who aren't associated with the school for whatever reason. They're homeschooled, maybe their child is 2 or 3. We do take kids all the way down to infancy if needed, and can help them with that. So You can always just reach out to me directly. I actually have a separate application form that I'm going to talk about a little bit that is aimed for people that aren't working directly with their school or another program for some reason.
Okay, awesome. And then really quickly, a comment and another question before we move on. A comment regarding the VSP Site for Students program. Youth organizations are also, they have these vouchers made available to them also. So while we have a limited supply, one could always contact a local youth organization, such as a Boys and Girls Club, a YMCA, that may have VSP vouchers available for students in your community also. And then a question from Brad, is there an issue with citizenship regarding the VSP Site for Students program?
That is a great question. So for many years, there has been the VSP program for many years. Their way of tracking gift certificates for many years had been with a specific identification number that people would put onto their form. And the typical ID that was used was a social security number. And so because if you're not a citizen, you don't necessarily have access to a social security number or one that you can use. It was a challenge for a lot of the families because they wouldn't be able to put that information on the form and able to, in order to be able to use the certificate. Just this year in a couple of community webinars with other organizations, what I've learned is that that program is shifting, and actually the new certificates that I've seen, there is actually a pre-printed ID. So each voucher has an ID. So the family doesn't have to have their own identification number, which takes social security numbers out of the system and means that whether or not you have one, you can still access this program, which is a phenomenal change and is going to make a big difference. So great question.
Yeah, and then just really quickly also before we move on, it occurred to me that something that probably should have been mentioned at the outset is that due to federal privacy law, or FERPA, that pertains to students' privacy, we are unable ourselves, when we screen 180,000 kids and we know that about 20,000 of them need to be referred for comprehensive eye exams, we are not able to contact those families directly because of FERPA. So that's one of the reasons why we're doing this webinar, is we want school nurses and parents and Lions to be aware of these resources to help us get the resources into the hands of families. Okay, Karis, you're doing a great job. Continue on.
All right, thank you, Doug. And I'm glad you said that, because one of the other questions I've been getting a lot so far this year, and I'm really excited that we're doing this webinar, is a lot of my school contacts have reached out and said, are you guys operating? Because their question is, with COVID-19 and a lot of offices being closed, is KEX still out there and able to operate? And yes, we are. So I've been sending out some email blasts, sent out the applications. But please spread the word to your schools, to your other contacts. We definitely are here. The fund itself, the funding for the program is really great, and we've got some great options for how it can function during this COVID-19 period of time. So I'm going to go into those a little bit more in just a minute here. But the Vision program, this is a program I am blessed enough to have been working with for 11 years now. I absolutely love it because every day I come in, every email that I reach out to with this program, every time I put a stamp on an envelope, that's a child somewhere in the state of Oregon who is getting help with an exam or a pair of glasses. And I absolutely love being part of that. This KEX Kids program serves students all the way up to age 21. So I mentioned infants. We don't get a lot of requests for kids under 3, but we do get 3 and 4-year-olds a lot. They're preschoolers who may be in a preschool program, or they may be have an older sibling who's in school. So they don't have to be physically in school if they're younger than 6, if they're not enrolled in a school yet. We definitely can still help those kids. We just work with the family just like we would if they were in a school. And then it goes up to age 21. So I've had some questions about that. That's probably one of the big questions. You'll find that a lot of the schools, there's kids with special programs that they're doing. For whatever reason, they may still be in high school at age 19, 20, 21. So even though you think of kids graduating around 17, 18, that's not always the case. And so KEX Kids will follow them all the way through high school as long as they're 21 years of age or younger. We also work with alternative programs or equivalent programs. So there's schools that maybe it's not your typical junior, senior high school. Maybe it's got special programs to help the kids actually join the workforce at the same time, or it's a blend of a junior college high school program. So we work with those as well. There's some youth programs that we work with. So there's a lot of different ways that 21 years and under will still be able to fit into the KEX Kids program. So always just reach out to me if you're not sure whether your kiddo will fit in that program or not, just ask me. The families need to live under 200% of the federal poverty level. And they either have no vision insurance at all, or they've used their current benefit plan. And when I was talking earlier, one of the reasons I went through some of the challenges with the other plans is because this is why KEX Kids comes in so handy. It's for those people with private insurance where part of it's covered and part of it's not, or they have vision insurance that's got a copay that the family can't currently deal with. If they're one of the current victims of the wildfires, that $50 copay or $25 copay, even that amount may be really out of reach for this family right now because they've just, maybe they've lost a lot of things, or they're both suddenly out of work because of coronavirus. And so they need that $25 for food. So there's all kinds of situations out there. There's also benefit plans that have a dollar amount limited for the family. So once they've hit that limited dollar amount, maybe they've got 4 kids and 3 of the kids are covered, but now they don't have enough left for the 4th one. So there's a lot of leeway in there that we want to work with. The other situation that families run into is how many times they can get a pair of glasses. So we all know, those of us who've been around kids, they have a lot of energy. They're jumping, they're climbing, they're rolling off the sofa and hitting, their glasses are flinging everywhere. And so kids do tend, their glasses get broken. I mean, it's just a fact. So things happen. There's also a lot of houselessness going on with families right now. So kids are going from house to house to house. And unfortunately, that means the glasses may have been left 3 houses ago, or the family stayed at a shelter last night, or in a car, or on the street, and those glasses are lost. There's so many things that can happen. So while we say 1 voucher per year, and while insurance plans will sometimes replace glasses, there are things that happen where those kids aren't going to have their glasses with them. Something's going to have happened to it, and they're going to need our help replacing it. And what we do is we just ask the advocate for the family, the school nurse, the school counselor, the teacher, or the mom or dad, just let us know like what happened, and if we don't replace this, what does that mean for the student? So if we have a student who literally can't see the blackboard, and their dog took their glasses and ran off with them last night, we're gonna want to do everything we can to help that child, and we're gonna find a way to work with you and make sure that they get back in their glasses. So if you ever are wondering whether or not, if you have a child who needs the glasses and you're looking at the information and you're wondering like, they don't seem to fit, run the question past me. It'll only take us a minute to talk about it, and chances are we can find a solution for it. So that's the basic program. And then I wanted to just tell you a little bit about why and how the KEX Kid Fund Vision Program works. So there's some key things. I mentioned that KEX Kids Fund nonprofit. That's where our funding comes from. They help cover our operations of the Vision Program. They reimburse the costs for the providers for the exams and the glasses. So that's a really key part. If they weren't here, the funding's not here. We don't have the money to operate the program. And then there's the Oregon Lion Sight and Hearing Foundation, which I love personally. And we are the ones that actually operate the Vision Program. So we handle all the phone calls, the back and forth, the application processes, all that information that goes back and forth, as well as the billing components for our providers. So we help them be able to get reimbursed for their costs. Now, the other amazing people that work with us are the school contacts, because you don't have this program if you don't have school nurses and teachers and counselors and school-based health center people, and even people that work at other organizations that love kids and are just out there and want to get them the help. And they help the families navigate these applications, and they reach out to us, and they really help keep us in touch and nudge those families to go use their vouchers. And then finally, the local providers. This is another aspect. Without each of these pieces, this program doesn't work. And the local providers are so important because these are the people that have agreed to take a reimbursement rate from the KEX Kids Fund that allows us to help a lot of different people. And without them, you know, how do we operate a program if we don't have a provider to work with? And I think we have a slide here, this next slide, that's going to show our statewide program. So this slide is, this is Oregon, and what you're seeing here is two different colored dots. So we've got some gold dots here. Those are our KEX Kids providers. So those are providers that are already working with our program. They are amazing. They take these vouchers from the kids. They even will look up the kids' insurance plans just to make sure that the kids' insurance won't cover this, and they'll help advocate to get those things covered through the insurance plan and save KEX Kids funding for that next child whose insurance won't cover it. And then these blue dots are providers who are members of the Oregon Optometric Physicians Association. And then in addition to that, you know, as well as I do, that there's all kinds of other providers out there too. And one of the things that you might notice, that there's some places where you can see that there's, you know, there's orange dots in quite a lot of this map, but you'll notice that there's also a lot of areas where we don't have any. Now, part of that is when KEX started, it was based on their listening area. So wherever their radio station went, that's where the funding went. And so it's really limited to kind of northwestern Oregon for the most part, sort of out to the Dalles. Well, we have had an amazing change in the last few years because they agreed to go ahead and open up the funding so that it would cover the entire state of Oregon. And so now we have this ability to use these funds to help kids in all the different corners of Oregon. We now have Dr. Palm, who down in the Sutherland area. We have providers in Central Oregon and in the Bend area, more providers on the coast. But there's still, if you look at this map and you notice that while there's a lot of gold dots, we have over 100 providers, there are still a lot of areas, particularly in the Southern Oregon area. As you get south of Corvallis, there's just very few dots. And what we're really needing to expand this program, we would love to hear from you. If you are a provider in those areas that's not currently working with our program, or you know a provider in those areas, we would love to talk to you about how to become part of our team. We need you so that we can help more kids. And there's definitely been requests for needs in the Klamath Falls area, in the Ashland area, and on the southern coast. I definitely get requests for those areas. And the only reason we don't have something that we're able to help with through KEX Kids right now is we have to establish a provider in that area first. So please, if you've got some connections, let us know, because we'd love to add them to our team. Doug, did you want to say something?
I want to ask you a couple of questions. A couple of them are from our audience, and one of them is from me. I know the answer, but I'm going to ask you anyway. So, of course, Oregon Health Plan and the VSP site for students vouchers, when an optometrist, a provider, helps a person, they get reimbursed through those two programs. Can you speak just briefly, since we're trying to recruit new KEX Kids Fund optometrists, partners, what can you describe the reimbursement rate that they receive when they see a child and the KEX Kids Fund voucher arrives and all that?
I would love to. What a great question. And I just happen to have a slide for that. So
then
if
wait,
we could go to that.
Yeah, well, okay, so wait for that slide to bring that up. I'm so sorry. Let me ask you the other question that came up. Okay, so the other questions that came up, one I believe refers to the KEX Kids Fund form. A question from Kathy. Who signs the signature of school contact?
So far, and I actually took that off of this year's form. So Kathy, if you need an updated form, email me after this program and I'll send you the new form, because I actually took that signature off. So what we have now, we're asking the school nurse or the school counselor, generally the person who was working directly with the student's family. And we actually do work with some medical organizations and even like Multnomah County Health Department, different places. And so just whoever's working with the family, that's who signed the school contact section. So we actually took that off now for various reasons, mostly because the program is operating a lot more online now, and trying to get that signature is tricky. And especially now when people aren't even always working in their school physical building. And so what we have is just a statement on there that says, by sending us this form and requesting a voucher, you're telling us that this information is correct. So we no longer are asking for that actual signature. And so that's a great question. And yeah, so if you have a form that asks you to sign it, reach out to me because I've got a newer one for you.
Okay, thanks. And thank you, Kathy, for that question. We have another question from Nick, which segues perfectly into our close. So Nick, your question will get addressed here shortly. Kareth, why don't you go ahead and continue?
Great. Well, I'm going to talk about how to join our KEX provider team. In general, for the team, how you join is you just let me know that you want to be part of the team and you want to serve kids through the KEX Kids program. That's really what we need is your name and your office address and the name of your business and who you want us to send the checks to. It's as simple as that. What we reimburse you for, we have a set rate that's reimbursed, and that's for frames and lenses. If your office provides the glasses, we reimburse $80 total for that. And then for the exams, it's a $60 reimbursement fee. Now for so every now and then, I will say that there are exceptions. Every now and then you will find a kid who needs bifocals. You will have a child with albinism or another very specialized vision condition, and maybe they need something extra. There's something very particular about the lens or the frame that they need. We have kids with that just have a physical challenge that they need a really special pair of very bendy frames, and maybe those frames are going to cost a little bit more. So then we can work with you to figure out what that amount would be. But in general, you're going to get an $80 reimbursement for the lenses and frames, and then a $60 for the exams. Now, one of the huge benefits that we've added to this program in the last few years is the Oregon Lion Sight and Hearing Foundation has an optical lab. This is an amazing finishing lab. We have frames and lenses here. We have trained opticians here in our office, and they actually are able to physically make glasses right here in a lab. It's actually like, you can't see me pointing, so I'm going to stop doing that, but it's off in the corner of our office. We actually have a lab that's actually being expanded right now because it's that amazing. And so with our lab, we actually have a kit of frames that we can provide for a provider. So say a provider is looking at that frames and lenses reimbursement, and they're thinking, you know, that might be a little tough for me to get by in my corner of Oregon where I am. That's going to be really tight for me business-wise. Or maybe it'd just be easier for them to have this box, which the picture here is actually our KEX Kids kit. It shows you that it's got 12 different frames in it, and each frame comes in a couple different colors. And then the kids actually will get one of these really cute little wipes too when they get the glasses back. So instead of using your own lab and your own frames and lenses that you have in stock, you can work with our optical team. You can fax the order up to us. We'll build the glasses. You'll have this handy kit right in your office that you can keep in a drawer. It saves you space because you don't have to have a big shelf out there. You can just take this kit out, bring it right to the family, show them the ones that they get to choose from. They pick it, you order it, we'll mail it back to you. And then what we'll do is we're still going to give you that $60 exam fee. So you're going to get reimbursed for that exam just like you would have anyway. And then what we're also going to give you is a $20 fitting fee, because you do have to have that family come back in and make sure the glasses fit properly. So in that case, you'll get the exams, and then you get a fitting fee, and we'll make the glasses. And then for whichever circumstance you decide to work with, we'll send you, once you send us an invoice, and we accept those in a wide variety of ways, so whatever's easier for your office. We usually within 30 days, you've got your payment back. So you're not expending these funds and then waiting for months for reimbursement. It's generally 30 days or faster. And the other note I wanted to make on if you use our optical lab is that they really are a quality product, and they all come with polycarbonate lenses, which is really important for kids. So it's a great option for providers to use this, but you don't have to. We're happy for you to use your own frames, and we have a real mix of what people choose to do. But it's that easy. So all you have to do is just let me know that you want to participate. We'll get you signed up and start sending kids your way, and reach out to the local schools and let them know that you're out there, and they'll be really excited. I got to tell you, the last provider we added over in the Bend area, as soon as you reached out to those schools in that area, they're very excited because it's an option that they didn't have before, and it really does help when they can actually say to the teacher or the family and say, oh, yeah, we can help with that. Let's get them hooked up. You don't have to wait and try to find that money or not get those glasses this year. We're going to help you.
Kareth, I'm glad you have the photo of the frames there, even though it's kind of hard to see them. They really are attractive frames with a variety of colors. And it reminds me of, I think it was about a year ago when a mother brought her son in to actually pick up the glasses from our lab. And the little boy, I think it was Isaac, about 7 years old, he was so afraid of getting glasses because he was going to be made fun of by his friends. And man, he put those glasses on and he got the biggest smile on his face. And because they were cool, they're very cool looking. So that's great. Hey, quick question from Lisa. Wasn't able to join the webinar at the very beginning. She was wondering if the slides are going to be available. And we actually will make this entire webinar available on our website. It's being recorded, and which Kareth loves when we record these. So we will not only have it available on our website, but we will email the link to all of our participants. So Lisa, thanks for your question. And yes, we'll send you the entire presentation probably sometime tomorrow.
And
Kareth,
then
back to you.
Yeah, thank you. I was going to say I have one more slide for all the school nurses and counselors out there, and for everyone else who's wondering about how to get the application and how that process works. So I'm going to tell you about that in general. So I'm going to talk about the program, how it's been for the last several years. Families will apply through their school. So whether they called us or they asked their teacher or they asked a screening, we'd say, oh, you know, go find out who your school nurse or your school counselor is at your local school, and they're going to help you fill out a KEX Kids application form and send it in to me. We actually do work with other organizations like Friends of Children, county health departments. If you're in a Boys and Girls Club, we actually work quite often with the Salem Boys and Girls Club. So if you're an organization that works with kids, we will work with you through KEX Kids. So although and it's a fairly straightforward application as well. It's a one-page application form. I generally do update it yearly. Sometimes the changes are fairly small. Right now, the form's been the same, fairly much the same for a while. And then every year I email that out to our school contacts. Used to send it by regular mail, but really everything is so much easier just to send it out by email, although I can still send it by mail if someone needs it that way. And then we just ask you to make copies or just completely use it online. And then you fill it out. You fill out that application as the school contact, and you get the information for it. And then you send it back to us. You can send it by fax. You can send it by mail. You can send it by, a lot of the schools have a secure email system. And I always tell the school nurses, I just want to get the form. So whatever's easier for you, that's the best way for me to receive it. It really works for me no matter what option you choose. So it's whatever's faster for you right now. That's what works. And then in general, the voucher once about 2 weeks later, and that's just to allow time for the data entry. Because depending on if I get 2 requests or if I get 20 requests, it can take a little bit to get the data entry done to get the forms into the system and then print out those vouchers. And then, so usually if you send it to me on Monday the 1st, by the 14th, you'll have your voucher back by mail. And then that voucher is good for a 90-day period of time. Now, it says 90 days, but as most of you that have worked with us know, we'll extend that. So we try to encourage the families to go within that 90 days, because if they're at this stage, they really need to go get that exam and get their glasses. But if something happens, the child gets sick, the family loses the voucher, maybe the providers, just something's going on where they can't get in there in that 90 days, just give us a call or an email, let us know. We'll just we'll extend the date and send you out a new voucher. If it's been like a year, I'm going to ask you to reapply for the family. But in general, if we already have it in the system and it just hasn't been used, we're going to let you reuse it. And then, so COVID-19 and how that affects this system. So it is a fairly straightforward system, whether COVID-19 is involved or not. But with COVID-19, it has had a few effects on the program. The big one that we noticed from last February over the summer is that a lot of families weren't able to get a hold of their schools. So that was kind of a challenge because not all the schools were open. Everyone was trying to figure out, what are we going to do? So I do have a separate application form if I have a family member who, for whatever reason, the school is closed or they can't get a hold of somebody or they're not working with the school system for some reason. I have a form that it's the same one-page application, but it has a space for the parents and it asks them to send in a proof of income statement. But in general, we are still, majority of our applications that we're getting, 90%, we're working with the school nurses, counselors, and teachers. But we've changed the form to remove that signature, like I mentioned earlier. And then because over the last few years, we've gone from you have to mail it and have it on a particular color, and there's all these requirements. Now it's nope, you can send it in on green, pink, purple stripe. You can fax it, you can mail it, you can email it, whatever's easier for you. That's hopefully helping the school personnel who may be working from home or working for 12 schools, but are working at one building and they're not really physically at the schools. The other change that we've made is we can send that form to the family directly. That's what we did over the last few months, is we've been sending most of the vouchers to the families because the schools weren't open. So now the application form very clearly has a spot that lets the school contact choose, I want this to still come to my school because I still visit there, or I'm not in the school, could you send it to me at home or to this alternative location? Or better yet, could you send it to the family that I'm working with directly? And if you choose that family mark, just so you know, I am, and so far I think I've been right about 100%. When I put that voucher in the mail, I'm emailing the school contact just to let you know that I've dropped it in the mail for the family, because that way you can help with follow-up and making sure they know that it's coming and to watch for it. And so I think that's the basic changes for the program. For a while there, our providers were closed, but they're open again now. But there's, with COVID-19, just be aware that they may not have as many spots available as usual. So if you're running into anything that you're hearing from your families or your kids where, there might be a delay with a particular provider because in some areas we have 2 providers for, 30 schools, and so it can get kind of full. Just let me know. Sometimes we have an alternative location that the family can choose from. There's all kinds of things we can do, so just always let me know. And speaking of questions, that's what we wanted to have time here for. Just in general, if anybody has any questions that we could help with, or Doug, if there's anything I missed that you want to jump in on.
Well, you didn't miss anything, but I'm going to relay a question to you, and it really pertains to the fact that the KEX Kids Fund Program, as mentioned, is entirely privately funded, for the most part through individuals that either respond to a direct mail campaign or KEX Radio's annual radiothon, which they are not going to be able to do this year. So if you're interested in how to support the program, please let us know and we can put you in contact with the KEX Kids Fund fundraising program to help sustain this program. Question, though, that kind of pertains to that, I got to admit, this might be a planted question from somebody from the inside, but it is a question from Nick. Question for Kareth: how can nurses and parents share the feedback that they, based on their experience with the eye doctor exams and the new eyeglasses, in ways that the program helped their children? How can they share their feedback, we assume their positive feedback, with us?
We love feedback, yes. And so last year I was actually sending out a little survey form with the vouchers. I haven't done that so far this year just because of some of the variable locations and things that are going on, but you can always email me. Please email me. Let the parents have my email. You can send it to me specifically, or we have a info, INFO, at olshf.org. You can send it there as well and just let us know what the family's experience like, what the program means to you. We love getting those stories. And as a matter of fact, this is perfect timing because They're not going to be able to do their radio fundraiser this year, and usually they'll play snippets of interviews, but they are still going to do their mail appeal. And it's always helpful for grant funding, for appeals to families to help. It's nice for us, the people that are operating the program, the people that are working to get the funding for the KEX Kid Fund Program. They love hearing about how a student got their new glasses and their experience in the classroom is so much better. Or we heard one time from a school nurse who said, yeah, this student was one of the kids always in the principal's office, and we found out it was just they were so bored because they couldn't actually see and engage in the classroom, and now they can, so it's a completely different child. So we love to get that feedback. And honestly, if you do ever, I'm trying to think if I've ever had someone have a negative, I don't think I have. We have our team of providers, they're just amazing. You know, they're just so good with the kids. But if there was ever something where maybe the family just found the experience to be a little daunting, or maybe I was slow getting a voucher out, or there's anything out there that you're just like, well, that was a little funny, or this could be easier, or I wish it worked this way, let us know that too, because I do take that into consideration when we make changes. And I love to get that too. So any kind of feedback you have for us, but particularly if it's the Nick that I'm thinking of, I know she loves to get the stories, and pictures are nice, cards. We do share them with our providers. We share them with the funders. We share them with the KEX Kids Committee members. We love, love, love to get feedback.
Okay, thank you. It was also suggested, I believe, from Kelly that we emphasize that not only the KEX Kids Fund options of glasses, not only is there a variety of colors, but there is a variety of sizes as well. So we're able to fit the needs pretty much of all children. Really nice comment from Mackenzie. Mackenzie, thanks so much for saying that you applaud the Oregon Blind and Sight and Hearing Foundation for the work that we do. Mackenzie's a school nurse in Multnomah County, and she's had the immense joy of extending our services to many families. Mackenzie, thanks so much for partnering with us. You know, the reality is we talk about how we keep this promise of addressing preventable blindness and hearing loss, and we do so with partnerships with people like you, Mackenzie. So thanks so much for your comment, but more importantly, thank you for partnering with us to bring these important services to people in need. And then I believe our board chair, who's participating, asks, what can the foundation do in the future to better serve the communities? And I really think, thank you for your question, Hank. I really think it's all about adding more partners, whether they're providers, school nurses, schools that want to work with us in terms of the vision screening, and of course, providing these services. We just need to continue to raise our awareness. So, you know, thank you for participating in the webinar. Let other people know about webinars that we're doing so we can further, you know, raise the awareness of the work that we're doing and continue to expand our sphere of influence in terms of partnerships. I think, Kareth, isn't there one quick little, short little video we're going to show before we say goodbye? Okay.
Yes. Is it the video that I was supposed to introduce a little bit ago that from a certain provider?
I think this is the perfect time to introduce it.
So we have another video we heard earlier from Dr. Remy Del Planche, and he actually has some great things to say about why he likes being a KEX Kids provider and what it means to him. And hopefully this will encourage some of the providers out there or some people you know to become part of this team and use the program.
I don't remember exactly when I first started with KEX Kids Fund. It's been probably 20 years or more. And initially it was just a few kids here and there. A few years ago we were doing quite a bit, and right now we are doing quite a bit still. It's just part of my practice. It's part of what I believe in. It's trying to get care to the kids that could normally not afford it. You know, of all the problems in healthcare with the politics of making money, which is everywhere, and dealing with compliance with insurance companies, seeing kids develop from non-students, non-readers into active students, active readers, and seeing that I'm a part of that makes it all worthwhile.
So we'll echo Dr. Del Planche's sentiment there, and you know, seeing a smile on a kid's face and seeing the world open up to them, it is what it's all about, and it does make it all worthwhile. Kara, thank you so much for sharing your knowledge, your expertise. Thank you to all of our audience for being part of our webinar today. I think we addressed all of the questions. Next week, oh, I do have a quick, exciting announcement. Many of you are aware that over the years, the Oregon Lion Sight and Hearing Foundation has been recognized as one of the 100 best nonprofits to work for in Oregon. And we just found out last night, not officially, but we were informed last night through social media that we're on the list again. In fact, we think we are really, really high on that list of best nonprofits to work for in Oregon. I'm not going to say a number because it's not official, but I think we're really, really high on that list of nonprofits. When I mentioned social media, it's because next week's webinar is for the social media challenged lion, I believe. And, you know, social media is such an important part of our lives for some of us these days. We want to be able to share how people can raise awareness of what they're doing, how they can raise more money, how they can have a deeper impact through social media. So join us next week for that. And again, Kareth, great job. Thank you. And hopefully we'll
Thank
see
you.
you all soon. Have a great day.